It's that time of year again. Open enrollment for the Washington Health Exchange. To help you navigate your options and sign up for health insurance coverage through the Affordable Care Act, we have Gary Franke with us this morning, an independent healthcare broker. Thanks so much for being here, Gary.
Absolutely. Thanks for having me.
Yeah, of course. So what should people know about comparing plans?
So for the Washington Health Plan Finder, open enrollment is November 1st to December 15th for January 1st. So that's the time period where you can compare plans. You can go on the Washington Health Plan Finder to shop around, find a doctor, look at prescriptions. The one key is a lot of times it's not quite as accurate, so just double check on the specific sites for that carrier.
Okay, and people can apply online, or they have to go in person, make a phone call?
Doing it online is the best way to do it, or finding a broker. So brokers don't cost anything for people to help out, and they can help them figure out how to do it online if they have questions along those lines.
I know some people's concerns when they're even shopping around for coverage is how much that plan's going to cost them, but if there's concerns about cost, is there any financial help out there?
Absolutely. So generally you're going to pay about 8.5% of your income for health insurance. So as you make more, you pay more. If you make less, you pay less. So you need to project what you're going to make for 2024 in order to figure out what the price you're going to pay. So it's just hard figuring out the gold, silver, bronze for what your needs are. So sometimes paying a little more actually saves you money. Sometimes it goes the other way around. That's where you need a broker to help you figure that out. So.
And what should people know if they've had any life events coming into this open enrollment time?
Yeah, so any time of year, if you get married or divorced, you lose your job or you're self-employed, there's different time periods where you can get it outside of the open enrollment period. But 95% of people can only change plans once a year. So.
Okay, good to know. Anything different this year compared to years past that might throw people for a loop?
The best thing about this year is things are not changing much at all.
Okay.
So the health exchange is changing the Apple Health, the Medicaid program. So people do need to renew, they do need to file their taxes every year. So from that perspective, there is some changes and updates where it's, if they ask you for documents, if you do not upload those, they will drop you from coverage.
Okay, and one more time, that window of time people have to do this?
November 1st to December 15th for January 1st, and then January 15th for February 1st.
All right, Gary Franke, once again, thanks so much for being here with us.
Absolutely.